Is off-label prescribing off the rails? So in the US, the FDA approves a medication at a specific dose range or a specific condition, and usually for a specific population, usually an age range or a specific gender. And any use outside of that is considered off-label. Now, the FDA explicitly condones off-label use, and they say that they're not trying to regulate medication, they're trying to regulate the drug supply and make sure it's safe and effective, but that a doctor should use their medical judgment for what is appropriate for their patient based on the available evidence. However, almost 20%, and by some measures even higher, of drug prescriptions in this country are off-label. Some of that is trivial. That's using a dose that's higher or lower, or using a drug like an ADHD medication that's approved for kids, using that in adults with ADHD. Another situation is using it for conditions where we don't really know whether it works or not. It also creates weird discrepancies. So some drugs that are known to have a particularly dangerous side effect are only approved under a REMS program, which is a risk evaluation and mitigation strategy. A prime example is ketamine. Nasal spray Spravato, which is a nasal spray form of S-ketamine, is approved for depression. It is highly regulated. There's only one dose size that's made. You can only one sprayer, but you can use 1, 2, or 3 at a time. You are required to use it in the doctor's office. The doctor is required to monitor you for at least 2 hours afterwards to check for blood pressure and hallucinations and dissociation experiences. On the other hand, there are hundreds of ketamine clinics around the country using ketamine off-label as either an IV, an intramuscular, or even a pill form. They use a huge variety of dosages, and many clinics are using dosages that at least some recent research or some summarized research recently indicates potentially in the range which in animals or in people abusing street ketamine have resulted in physical brain damage and deficits in thinking. The FDA tightly regulates one form of a drug, and the same active ingredient, the same drug, is used with basically no restrictions by anyone who thinks that it's likely to help the people they're treating.